Hi, my name is Joshua Alcon, and I'm a third-year pharmacy student at the UNM College of Pharmacy.
My name is Rachel Crusius, and I'm a P3 at the UNM College of Pharmacy.
I would recommend taking biochemistry before coming to pharmacy school, just because when you first come into the program, one of the first and hardest classes that you're probably going to encounter is biochem. And so if you can either take it towards the end of your undergraduate career before entering pharmacy school, I think it'll be very beneficial. And biochem would be pretty easy for you to fly through.
So I didn't personally, and I still got an A in the course. From what I understand, even some of my classmates who did take biochem, people who got undergraduates in biochem, it only really helped them through the first exam, and then we got into very specific pharmaceutical biochemistry. So they might have understood the meaning of a phrase immediately, but the details of it they weren't as privy to. So if you have the time to take it, I don't think it'll hurt, but if you don't, it's not the end of the world.
That is probably the most common question that I think every student always gets asked, and I got two answers for it. The first one is yes, and it's difficult, but it's doable. And the second part is, it is difficult, but you have to remember that it kind of needs to be, because in 4 years after you're done here, you're gonna have people's lives in your hands. And it's going to be your job to catch any errors that you find in their medication therapy, and having people's lives in your hands is a big responsibility, so it has to be difficult.
Sure, it is, but it's doable. It's all about time management. That's the biggest skill that I try to emphasize to incoming students. You need to be honest with what study time you need, what downtime you need, if you work, if you want time with friends or family, and really manage your time and be honest about how long your studying time is going to take or how much time you need. I personally start studying for tests a week out, and in undergraduate I didn't study at all, so it was definitely an adjustment for me. But as long as you can manage your time and you don't let things pile up on you, you'll be fine.
I don't personally work while I'm in pharmacy school. I do work in a lab doing research, if you want to call that work. But I do have several classmates who are friends of mine, and they all work, and they all recommend it. They do say it can get a little hectic sometimes with our schedules, but it's nice for you to be working and putting into practice what you're learning in the program. So they recommend it.
Yes, absolutely. It's one of my biggest pieces of advice for incoming students who come to see the campus. When I was a tour guide, I would tell them, if you don't have a job in pharmacy, you should get a job in pharmacy. It helps you recognize the drug names and know how to spell them at the minimum. And if you know anything else, it just puts you that many steps ahead of the game. I personally work 2 jobs while I'm in pharmacy school, and it is doable. You just have to be honest with your boss and with yourself about what you can work and what time you have available and what time you need for yourself and for school. But I absolutely recommend working in pharmacy school. It helps keep up with current drug trends and the latest changes in pharmacy while you're learning about it.
The faculty here are amazing. I know day one, when they get a class composite, they're all trying to learn your names and your faces so they can really get to know you. They're always open to questions, and they're always open if you want to talk outside of class. And something that's really nice is we offer mentor groups here, and you really get to know a specific faculty member one-on-one, and there's a lot of opportunities with the faculty here as well.
The faculty is great. They really care and they don't want you to fail. I know when I interviewed at a couple of other colleges, the faculty there, they would blatantly say, like, I teach a class that weeds kids out. And it came off very like, either you'll make it or you won't, and that's not my problem. While here, some of the classes are difficult, but they want you to succeed. And if you email them with your questions, if you set up their times and really work with them, they'll work with you. So I really appreciate the faculty here.
Yeah, so there's definitely a lot of opportunities to work with faculty. In fact, day one, when you come into the program and you start classes in biochemistry, my mentor is Dr. Todd Thompson, and he is more than willing to get you involved with research if you're looking for research opportunities. If not, there's other opportunities to do like clinical research. So working with a lot of the faculty here that are pharmacist clinicians, they offer so many different opportunities.
I actually became close with my mentor. Every student here gets assigned a mentor that's a faculty member, and along with a mentor group, which is pharmacy students both in your year and above you. So I became very close with my faculty mentor member, and she taught me a lot about some of the research that she did, which I found very interesting. And she actually reached out to me this semester and asked if I would be willing to work with her on her next research project, gather some data, and do some statistical analysis for her. And I know that there's a lot of opportunity to work with faculty, especially if you do some of these dual programs, these masters and things like that in pharmacy as well. You are actually required to work with faculty, and they are more than happy to work with you.
So studying is a big part of what you're doing as a student, and the way I unwind is I'll either go hang out with some friends, play video games. I definitely recommend going to the gym as much as you can, and this is probably one unique thing that I do, but I practice sleight of hand, so it's a little hobby I picked up before I came in just to waste time.
So I like video games. I also go rock climbing at a local gym here, and that's a nice way to get my body moving and not use my mind so much, especially after it's been like a stressful day of studying. I think the big thing for me is I set a time when I'm going to be done with school. Usually it's around 8 o'clock. Anything past 8 o'clock, we're just done for the day, and then I need to go, take my bath or play a game, watch YouTube, whatever it is, so that I can unwind and sleep well and start fresh for the next day. I feel like a lot of people don't have that self-limit, and then they run themselves ragged and get burnt out, and that's the last thing that you want.
That's a really tough question, but aside from all the amazing people that you meet and all the opportunities that you have here, my favorite part would probably be all the learning that you do while you're here in this program. As you go through the program, you don't know anything about any of the disease states, and then by your 3rd and 4th year, you look back and you've just learned so much, and that's definitely got to be my favorite part.
My favorite part about pharmacy school so far has probably been my friends that I've made. I'm not from Albuquerque, I'm from Dallas, Texas, and I was very nervous about coming here. I knew nobody. Most people, they worked with some of the classmates or they did undergrad with some of my classmates, and I literally knew nobody. I actually recognized somebody from my interviews, and I had liked her when I talked to her at interviews, so I went up to her and was like, "Hi, I don't know if you remember me, but I'm Rachel, so it would be nice to be friends." And we hit it off, and everybody here was very welcoming and very sweet, and it was very easy to make friends and get involved. And it's connections that you'll have for a lifetime. I really value that.
My best piece of advice for an applicant is, one, for sure go shadow a pharmacist. Make sure this is what you want to do. And my second best piece of advice would be, once you're in the program, work hard and just remember what the end goal is to become the best pharmacist that you can to help your future patients.
Time management. It's the biggest factor. It's the biggest thing that I've seen among my peers of people who make it and people who have a really hard time. You have to be able to balance the things that you need and the things that you need to do and be very honest about the time that these things take. If you don't have time management skills, I very much recommend trying to develop some before you get here. Obviously, if that doesn't happen, there's resources here and people that can help you with time management. We have a great counselor here named Diana, and she does fabulously with helping people about time management and really being honest about your schedule and what time you do have.
That is definitely another question we get asked a lot. And I think the hardest part with pharmacy school is learning how to manage your time. You come in and you're so gung-ho about studying all the time that you kind of lose sight of taking care of yourself and making time for yourself. I know I struggled with that. And some advice that I got my first year that really helped me was, on Fridays, that's your day off. You don't do anything school related, you go to class and then you're done studying. And you gotta make sure you find time for yourself. That's the best advice I could give, especially with how difficult everything is.
Probably the balance. So it's really easy with pharmacy school to see your tests and your assignments and your presentations that you have to do and let it all build up on you and kind of take over your entire life. And while it's important and these things do take time, you have to have some time for yourself, sometimes for your friends and family, things like that, so that way you don't just lose your mind and burn out, because when you burn out, you're not going to succeed. It just makes it 100 times harder. So really just maintaining a balance between school and studying, but also taking the time to go out and have lunch with your friends, or going on that hike on the weekend, or just sitting with your parents at the end of the day and watching a TV show. It really helps maintain your sanity through what can be a difficult time.
You know, it's really unique. You see everybody and you're like, oh my gosh, I wonder if they're just as stressed as me, and they are. And it's really up to you to go and interact with other different health professions on the campus, and that's something that I've been working on. I've been trying to get together with medical students and some PT students, and it's a really unique field that you're all struggling and you're all working hard just to become an expert in your field.
I enjoy it personally because you see everybody at the same time putting forth so much effort, but then also you'll see the PT students out in the quad playing, I don't know what it's called, handball, smackball, something weird, or you'll see the med kids down having coffee at Healthy Heart. So it's nice because you see them putting in all the effort, which helps motivates you, but you also see them relaxing and taking time, and it's okay to take that time. And then I feel like it also helps because you'll run into these people, get to know them, or sometimes you'll have classes where you're doing interprofessional assignments, and it just helps you get to know these other professions more, maybe understand better once you're a pharmacist how you'll be working with these other professions. And it just makes it a more like cohesive, like supportive experience, I feel like.
Yeah, so I would definitely look at UNM and see all the opportunities they offer. I know when I was applying to different universities, the reason I chose UNM is they had the opportunity to pursue a master's degree at the same time that you're getting your doctorate. So that's one thing. And two would be look at what you want from pharmacy as a career. There's so many different avenues that you can take with pharmacy, and New Mexico definitely offers some of the best pharmacy programs in the nation. We're leading the way in terms of healthcare for pharmacy. We just passed a major bill called House Bill 42, which now gives pharmacists the ability to bill private insurances for their services. So definitely look at what UNM and New Mexico offers in pharmacy.